Thanks for joining us for this week's Health News You Can Use. I'm Lindsay Stish. This week we're talking about the neurological impact of COVID-19. I'm here today with Dr. Karen Olds, the Stroke Medical Director for St. Luke's Marion Block Neuroscience Institute. Thank you so much for joining us.
Thank you.
Well, a recent study of people hospitalized with COVID-19 found up to 80% may experience neurological symptoms. That can range from mild issues like headaches or loss of taste to those more serious like strokes. Today we'll be talking about how the coronavirus can affect the brain and what neurologists are seeing at St. Luke's. Well, Dr. Olds, in regard to the study finding neurological symptoms in 80% of patients with COVID, can you help put that into context?
Yes, that's a great question. The studies that are reporting a high rate of neurologic manifestations of the SARS-CoV-19 virus are including symptoms such as headache and myalgias, which is a fancy term for muscle aches, dizziness, fatigue, loss of sense of taste or altered sense of taste and smell. And those are not necessarily specific to the coronavirus, but are common in a severe viral and upper respiratory infection. More severe neurologic issues such as movement disorders, strokes, and seizures are less common. Encephalopathy is a rather fancy term that we use for kind of like delirium, and that's very common as well. And that one is related to worse outcomes.
And some studies have also linked COVID to severe strokes, even in people as young as 30. Can you explain what can cause that, and are we seeing this at St. Luke's?
You know, Lindsay, a few weeks ago, I would have said that we were not preferentially seeing it at St. Luke's, but we have seen a young, relatively risk factor-free stroke patient admitted with SARS-CoV-19 that did have a stroke while she was in the hospital, which we were able to minimize symptoms with reversal therapy. I've seen it listed as much more common. I've seen numbers from 0.4 to 1.2%, but it's not preferentially just that it's affecting the brain. It seems to be in some people, it causes them to mount a severe inflammatory response, and part of that inflammatory response results in clotting. And we've definitely seen folks at St. Luke's and have reported across the world that are having clotting problems with this virus in particular, and perhaps it's affecting more the endothelium or the inner lining of the blood vessels in this massive inflammatory response.
And are there any known long-term neurological impacts of COVID?
The studies that talk about the longer-term neurologic impact in folks that aren't doing as well, typically we're seeing that in the older clients that get COVID-19 that have more severe illness, which is really measured mostly by requirement of being on a ventilator. And those folks, if they develop delirium or encephalopathy, they tend to have worse outcomes, more long-term sequelae, less likely to be able to go home after a hospitalization with COVID.
And when should someone see a doctor for any of these neurological symptoms?
I think if you have the more common symptoms associated with COVID, dizziness, fatigue, headache, or problems with sense of taste and smell that necessarily requires you to see a doctor, if you get over the illness and you're still not able to, over the next several weeks after an upper respiratory illness, to feel back to normal, then perhaps that's when I would reach out.
Now, shifting away from COVID, several studies have shown the number of strokes and heart attacks rise in December and January around the holidays. What are some things people can do now to lower their risk?
Lowering stroke risk and heart attack risk is just taking good care of yourself. So watching what you eat, watch your carbs. If you're diabetic, make sure you have good control of diabetes. That tends to be a problem around the holidays. Hypertension, the holidays can be stressful. You need to make sure you're taking medication and keeping track of your blood pressures at home.
Now, with that in mind, can you remind us of some of the warning signs of a stroke to watch for?
Absolutely. So we teach B fast. B is for balance, and that would be sudden onset of something like room spinning vertigo. Eyes is loss of vision or double vision. And then FAST stands for face, arm, speech, time. So unilateral weakness of one side of the body or the other that can affect the face, arm, and leg, or maybe just two segments, face and arm. And T stands for time because it's very important to get help very quickly. We're able to reverse stroke symptoms in many cases cases as long as you present to the hospital. So don't be afraid to go to the hospital for emergencies.
Now, lastly, what's your final message for anyone watching today?
I think it's important to understand that the COVID-19 virus is very easily transmissible. So the simple things that you hear about doing in regards to hand washing and wearing masks and social distancing are what's most important. We can't really let down our guard with that. But on the other hand, we have to temper that with the social isolation problems that this pandemic is creating for us. And we see a lot of problems with that with older folks with neurologic diagnoses, and now they're not able to get the help they need. So please make sure and reach out, be kind, reach out to your family, your friends, your loved ones, do it as safely as possible. Try to be accepting of others' choices, but try to protect yourself.
Well, thank you again, Dr. Olds, for joining us. If you'd like to find out more about COVID-19, including testing information and other resources, visit stlukeskc.org/COVID-19. Next week, we'll be talking to Bruce Lisey about how to cope with grieving the loss of a loved one this holiday season. If you have any questions for Bruce, you can send us a direct message to our main Facebook page. That's at St. Luke's KC. You can also stay up to date with all the latest developments on the COVID pandemic and other health news from St. Luke's at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.